the basics of how to use the connector, some advanced tips and tricks to improve the efficacy of your use of the connector, as well as cover how to use some functions that can help supplement your outreach and enrollment efforts using the connector. After covering organizations, locations, and assisters, it's time to dive in and look at how appointments work in the connector. So to start, let's go into pages. There are a couple of things you can do from this page, though, that are important to cover that are distinct from the simple adding of appointments that I want to cover in this video. The first is that you can update the appointment status, which refers to whether or not the consumer completed their appointment or showed up to their appointment in the first place under the appointment status using this drop-down menu. You can also look at the enrollment statuses, which refers to the appointment outcomes, by clicking on this drop-down. So I could mark that this consumer was enrolled in the Medicaid. We'll cover this more in another video, but you also have the ability to add the result of a call you made using this page in the appointment window. So I could say that I talked to this consumer and add that information. You could do this for multiple consumers as well. So this appointment was completed, and this consumer enrolled in the marketplace. This consumer didn't show up. This consumer didn't show up. And this consumer canceled. To save these results, you'd go and click the blue update on the page. The call result will go back to blank so that you could add a future call result. This is because you might make more than one call to a consumer for an appointment, but you're not going to have more than one final appointment status for a consumer. And so it's important to have the most recent one up to date on the page. You can also view or edit the consumer's information at a glance by clicking on one of these buttons. Let's look at editing this appointment. Enrollment status allows for tracking those top-line results. It ignores the wealth of information that you can store in the connector, not just in terms of call results, but in terms of appointment outcomes. You can record a consumer's eligibility for different plans, how far they got in the enrollment process if they weren't able to finish, not just update their information if, say, there was a mistake in recording what they said on the phone, or there's a better. You can add a refer, including the queue feature, which we'll go over, media and social media, a healthcare provider, and so on. You can leave a note about the refer, and even add a language. Below, though, is where it gets really important requirements, including the number of individual consumers for this appointment, their language, and all the different things they were assisted with, and the total number of people assisted with each one. So in this case, this consumer had 2 people in their household that they were trying to get help with health insurance. They were assisted with applying for a qualifying health plan, and they were not assisted with applying for Medicaid and CHIP, so we'll uncheck that box. If, for example, this consumer fell into a coverage gap, say they were above the cutoff for Medicaid but couldn't find an affordable plan, you could add that 2 people fell into a coverage gap, and that you helped 2 people file an exemption. You could add a note including their income, or anything else that you feel is an important thing to note here, depending on what your organization is going to be tracking. This is important not just for grant writing, but allows for a rich history so that when questions come up about an appointment or a consumer has a follow-up appointment later, you can go back and look at these details and understand exactly what happened. So if this consumer, say, was applied through the healthcare.gov and was referred over to Medicaid and CHIP, we would know that next time they came in, that they were already through that process, and we could just be ready to help them select a qualifying health plan, for instance, on the marketplace. When you're done updating this appointment information, hit the Save Appointment button at the bottom right in blue to save